Good afternoon. My name is Nihal Samara. I'm the General Counsel and Legal Director of the law firm Kaizen Synergy. We have been running the pandemic legal updates for some time now and will continue to be doing so, especially as we move now to an extended state of emergency, as we can see in Victoria. With this process, part of what we are looking at today is what is the impact that it will have for your agency, or what does this actually mean? There is also new guidelines being issued by the WHO, and there's some confusion around that in terms of what that also means. And there's a bit of mixed messaging around that, which we'll see considering updates made from the WHO around opening up the Wuhan markets. Equally on this, of more closer to home relevance, was some of the local fines and enforcement measures that are actually in place. And equally, just looking at really what does this mean for agencies like yourselves as well. One of the other parts that we will also cover is around the specific mandatory vaccinations, other policies that your agency should be looking at, and also systems of what you need to have in place really to manage some of this stuff moving forward, so to speak, as well. So we will be covering these off today, and also looking at the key legal requirements that your agency needs to continue to meet throughout this process. As always, we'd like to pay our respects to the elders past and present. While this session is being run by webinar, we do pay our respects to the traditional owners accordingly. So as I mentioned, the key topics that we're going to be covering off is looking at extending the state of emergency and what that actually means. Some of the WHO criteria, around the 6 different criteria that the WHO has actually issued. The application for your agency around policy positions, as I mentioned, mandatory vaccinations, fines, and also new tenancy developments. The tenancy developments is obviously important for those agencies providing community-based housing, and also where tenants or clients might actually seek advice from yourselves. And this will actually answer some of the common and frequently asked questions that we have been asked about, certainly over the last few weeks. So let's have a look at this around the extended state of emergency. Certainly in Victoria, this has now been extended for another 4 weeks, and the purpose of this was to give the Victorian government the powers it needs to keep slowing the spread of the coronavirus. During this session, we will also briefly look at when we talk of flattening the curve, and you would have heard about this in the media, from a public health point of view. Certainly that's my area of background, apart from the legal side, around what does this actually mean, and what can your agency actually look at the relevance of this for flattening the curve at your end, so to speak, as well. So this is really extended until midnight, 11th of May 2020, to allow the continued measures that are designed to flatten the curve of the coronavirus and give the health system the chance of managing it as well too. It's important just to acknowledge that the original state of emergency was due to expire on the 13th of April. With it, there is a media release which we will also be circulating around with these slides, and also this material as well too. With that, I will also add that these webinars we have made publicly available while we are loading them into people's Gemba 360 e-learning college hubs. We are also making these materials and presentation slides available to assist with this current public health challenge. Now, under the state of emergency, authorised officers at the direction of the Chief Health Officer can do 3 basic things, which is actually important in terms of providing direction to your agency and where we start to look at some of the policy impacts. So the 3 things that they can do is actually eliminate or reduce a serious risk to public health by detaining people. They can restrict movements, preventing entry to premises, or also providing any other direction an authorised officer considers reasonable to actually protect the public. That said, the rules and infringements that have been provided over the last few weeks are now continue to be in place all the way through for another 4-week period. So under the biosecurity legislation, the key messages have been to leave home for effectively 4 reasons. This is around food and supplies, medical care or caregiving, exercise, and for work and education purposes. Now, the police have continued to have strong powers to enforce these directives and can issue fines, which we have covered significantly in the past webinars. But just to repeat these can be up to $1,652 for individuals and up to $9,913 for businesses. And where businesses like your agencies come into effect, we have previously spoken about where staff or services you may deliver don't meet the specific requirements, especially say under the tenancies requirements, then effectively your agencies could be held accountable for and receive fines in order for non-compliance notices. With that, it's also important to note that under the state of emergency, people who don't comply, so if you don't actually continue to meet the requirements or directions, then individuals can receive a fine and be taken to court of up to $20,000, and companies actually face fines upwards of $100,000. With this, since March 28th, certainly the Victorian Police have now conducted some 19,303 spot checks at homes, businesses and non-essential services across the state, and issued some 900 fines. So with this, certainly in the news reports, there is now processes in place where the Deputy Commissioner and the likes may review these fines as well too, and there's an escalation process around this. But that said, part of this is that the police are actually taking this very, very seriously and readily issuing fines for non-compliance around these particular areas. Now, what has happened in the last few days is that the World Health Organization has issued 6 criteria for countries to actually look at removing or reducing the current rules and enforcement measures in place. Now, these criteria, when we look at these, there are 6 of them, is to make sure that if these criteria are met, then effectively reduction in some of the current enforcement measures can occur. Now, these include transmission is controlled, the health system can detect every case, outbreaks, risks are minimised, preventive measures are in place, importation risks can be managed, and communities adjust to the new norm. And we have heard now that there is reported national spread of coronavirus, which is dropping to around 2% of growth. So for agencies, what we're looking at here is positioning yourselves from a legal compliance point of view to start to look at what are the criteria that the Australian government and state governments will be looking at. And this will actually start to guide your agencies in terms of your own policy positions, and we'll start to work through that today as well. So we know that the WHO criteria has issued these guidelines around this. Obviously, things like importation risks can be managed is of no real, I guess, direct relevance to many of your agencies. But it's saying that we can actually look at, well, what is the outbreak? Is there measured controls that you have in place within your agency to actually look at the clients that you are currently servicing? Has that continued to spread? Are you in a growth area of growth, or is it in fact being managed within your catchment area? And you can start to look at putting these, and we've started to do this with other agencies that use the Gemba 360 disaster system, to actually start putting some of these measurable items in place, so that way your policies can start to reflect, well, how are we actually looking at controlling transmission? Are we, in fact, if we provide medical services or fever clinics, detecting every case? Is this being expanded to our staff, etc., in terms of what you are looking at as well? That said, there is equally, we just need to acknowledge that there is some skepticism around the WHO's guidelines around this, particularly from our own Australian government around this, where they have, the WHO have claimed that China's wet markets could be made safe to sell, continue selling its food, and reopen it in terms of its food and income. Quite openly, Prime Minister Scott Morrison has quite openly condemned this on Monday, saying that there needs to be a demand for transparency, considering that the outbreak has been reported to originate from the Wuhan wet market, and equally other areas like other public health challenges like SARS and the like has equally also originated similarly from these wet markets as well too. So there is some just acknowledgement only around this of some of the criteria that the WHO have set, when on one hand they have provided the criteria, but then on the other hand equally provided some direction that the China's wet markets could be reopened as well too. That said, what do we mean by flattening the curve, and what does it mean for starting to look at some of the public health requirements for your agency? So flattening the curve, and this is something that many people say, well, it's just simply around dropping the number of cases, and that's true to some degree. Effectively, flattening the curve has become rapidly a catch cry around this COVID-19 pandemic. And it really has been popularized by many media outlets and leaders worldwide. Effectively, what we're talking about here is looking at a reduction in the number of cases, and thereby helping to prevent the health system from being overwhelmed. And effectively, the diagram on the right depicts what this actual flattening the curve is, how it actually moves, and what the outcomes of these actually are. One of the issues that we do raise around this from a public health point of view, and certainly in legal compliance when we're looking at policies now around this, is looking at the flattening the curve actually has a consequence that a lot of the media don't actually talk about. And effectively, what the worrying consequences are is by flattening it, it actually approximately doubles the duration of the epidemic, and the total burden of cases actually remain the same. So this implies that social distancing measures and management of cases, with their devastating economic and social impacts, may need to actually continue for twice as long if governments continue to go all out to effectively flatten the curve. Now, where I link this from a public health point of view, if the state and Commonwealth keep on talking about their focus on flattening the curve, where we can forecast where the legal compliance obligations may end up is to actually, what we're actually seeing now, is to actually extend the state of emergency. And Daniel Andrews has effectively said that this may be also extended past the 11th of May, or if it is reduced, that some of the rules and regulations that come from a public health directive may actually be extended, even though there may well be no more new cases and the likes, but effectively the public health consequence is, as I point out, that it may actually continue for a period much longer in order to continue to flatten this curve as well too. So it may well be, I just draw your attention to this, particularly from my public health background, that when we look at talking about flattening the curve, the correlation between um, Parliament members or members of Parliament continuing referring to flattening the curve, it may, as I mentioned here, this implies that the social distancing measures and the management of cases with their impact on economy and social impacts as well too may actually mean that your agencies have to actually push out some of your policy obligations in order to meet those directives. So it is something that I do mention to you what it means when we do look at this. So for your agency, part of this, we look at the directives coming out of the state and Commonwealth. Effectively, Premier Andrews in Victoria has mentioned, and as of today as well, again, that they're looking at aggressively tracing the outbreaks and making sure that the virus does not get away from them or us. And if it does, it's looking to make sure that the health system can actually meet the demands that are obviously being scheduled to happen. Equally, Australia's Chief Medical Officer has also warned on easing the restrictions in the near future. And so this is where, when they talk of, we can see that there is directions around this, and the very clear language of flattening the curve effectively means that your agencies may need to extend some of its pandemic services in order to address these challenges as we go. And look, as they do point out, the strategy is fundamentally working. The alternative is, of course, if we see what's happening in places like Europe and New York, where there is a significant fatalities, which is obviously what is being tried to be avoided here. So when we look at the rules around this, just briefly, before I get on to looking at the mandatory vaccination requirements and also the tenancies agreements and the likes, the four main messages from a policy point of view is that people should be really leaving home to get medical care, go to work for daily exercise, and to buy the essential things that they need. With that, you can start to look at the WHO criteria in terms of within your own agency around whether transmission is controlled if you're providing the medical services, but equally if you are providing housing services, is anybody in isolation? Have there been any other cases? You can start to use some of these criteria to actually manage and start to gauge an impact for your agency. Within this, what we have set up for many agencies is around the pandemic system, which you can see here. And effectively, under each of these activities, we have started to feed into the parliamentary areas around looking at initial actions, targeted actions, which is where we're at, and effectively starting to look at individual items around delivering and governance that you may need to see across this. So effectively, a lot of agencies have taken the pandemic system up to effectively manage their work and projects and budgets around this pandemic. Certainly something that we did see within the swine flu period and pandemic was when we come out of it, many agencies at the time were looking at, well, what is the cost of our agency? And effectively, they stopped calculating at some period. This will effectively allow you to budget people's times, and also every time a staff member undertakes a pandemic activity, like you can see here, effectively time is being effectively billed and monitored so that you can run out your reports back to the state and Commonwealth departments as you need to in the future. But that's certainly part of the Gemba 360 pandemic system that many agencies are utilising. So effectively, the rules which we've covered off in the past, I won't go into this in too much detail, is around what does the maximum gathering of 2 people mean, which we've covered off in the past. Childcare centre rules still apply where there is a risk or there is not a significant risk or significant transition to the community, and that still applies under this extended state of emergency. The similar rules around weddings and funerals continue to apply as well too, and some agencies have already looked at guardianship and powers of attorney where they do provide aged care facilities in order to get their information to clients and make sure that people are aware of what their obligations may be moving forwards. One of the areas that I did want to cover off was around the rules for tenancies, and this has been quite a topic for discussion. So with it, what we have seen is that we know that for many Victorians, it is an economic crisis as well too. What was put up was a notice that for the next 6 months, there was a moratorium on evictions, but it wasn't very clear on what these would actually be. And with that, what the Commonwealth, together with their state counterparts, have informed people about is to put a code of conduct together. And that's actually issued by the National Cabinet. And with that, they have offered some guidance around those particular requirements as well too. Now, when we look at this, what has come up is a couple of questions that people have asked. Effectively, can my landlord evict me during the crisis? And effectively, we have put some details down here, and we will circulate these out to you to look at some guidance for you as well too. With that, what you will see is that there are effectively 3 specific items that tenants need to show. That is that one or more rent-paying members of the household have lost employment or their income. Effectively, if one or more rent payers have had to stop work due to illness, and also that the above factors may have resulted in their household income that has been reduced by 25% or more. And so one of these things that we have seen is that people have said, well, we need that there is an expectation for no rent to be paid. So part of this was to actually have some of the negotiations with the landlords. This may impact where you may be providing services under your housing arrangements as well too. Equally, some of the other questions that come out is that can my landlord continue with inspections, including open houses as well too? And there are actually specific guidelines for that, and these are listed here as part of that process as well too. So you can start to know your rights around that, especially for the clients that you support as well too. And there is specific requirements that they do need to follow during this time as well. With that, there has been a number of agencies that have said we're trying to negotiate a rent reduction, but the landlords actually do want a lot of personal information. So effectively, there is some information that does need to be provided in order to actually start these negotiations. It may well end up in VCAT if that's the case, but some of the general information that they could ask for by clients is bank statements, and also other information like confirmation that a loss of job or income has occurred as well too. But again, we'll circulate these out with these slides to all attendees. So briefly, without going into it in much detail, certainly there are fines which we have covered off, and these are reflected in other states and territories as well, which we have covered off in previous webinars. One of the other items that I did want to mention was around the mandatory vaccination bill as well too. Now, this was something that actually we did get a number of follow-up questions on from previous webinars that we did run. And with it, in Victoria, there were new laws which will mean that healthcare workers must be fully immunised to protect themselves and their clients or patients against the flu each year, as well as whooping cough, measles, chickenpox, and hepatitis B. So workers in public and private hospitals, ambulance services with direct client contact will be required to be vaccinated. And these include doctors, nurses, paramedics, dentists, orderlies, cleaners, staff working in the public sector, residential aged care services as well. So workers who refuse to be vaccinated may face work restrictions or redeployed to other parts of the agency. And this was something that the Honourable Jenny Mikakos, Minister for Health, actually issued back in February this year, 19th of February 2020, and the media release is also attached for your reference as well. So with it, there is a new mandatory vaccination bill that still applies, and this was certainly, position was equally confirmed by the Chief Medical Officer in Victoria on the 2nd of April. Now, what's important here was that what they were looking at was trying to prevent people from getting something else and also the coronavirus if they unfortunately were exposed to it. And that was something that they confirmed on the Thursday, the 2nd of April, that this should still be continued. So in terms of the recommendations, what we are recommending is quite straightforward in principle. That is, continue to align your policies and pandemic disaster activities with the Commonwealth and state directions. So effectively, the period of extension now runs all the way through till the 11th of May 2020. There will be restrictions in place. This doesn't mean that it just ends on the 11th of May 2020, but effectively have a process for managing this well beyond the May date as well too. Equally, we will be running separate legal webinars for agencies covering off different aspects and different states and jurisdictions as well too. And our pandemic disaster system provides the stage response, and we will be providing you frequent updates around that and areas that you should be focused on as well. With that, if you do have any questions, happy to stay on the line and answer any questions that people might have. With that, if you do have any questions after this webinar, please contact us on 1300 360 360 or email us at support@gemba360.com.